afternoon. My name is Maggie Murphy. I am the Executive Director of the Hospice and Palliative Care Federation of Massachusetts, and I'm here today with Laura Tuttle, who is a hospice nurse and a member of the Federation. Thank you, Chairman O'Flaherty, Chairman McCrean, members of the committee, for the opportunity to testify before you today to state the opposition of the Hospice and Palliative Care Federation to House 2233, an act relative to death with dignity. The Federation is a nonprofit organization founded in 1980 that advocates for compassionate care of the dying and serves as a voice and resource for our 59 licensed hospices, palliative care programs, and more than 100 other individuals and organizations committed to advancing excellence in end-of-life care in the Commonwealth. Last year, our 59 hospices served more than 21,000 terminally ill patients and their families, and the 8 hospices involved in the Pediatric Palliative Care Network served an additional 235 children with life-limiting illnesses and their families. The Federation opposes the practice of physician-assisted dying as it is inconsistent with the philosophy of hospice, which is to neither hasten death nor prolong life. Our founder, Dame Cecily Saunders, said, "You matter because you are. You matter to the last moment of your life, and we will do all that we can, not only to help you die peacefully, but also to live until you die." The debate about physician-assisted dying suggests that the only choices are end-of-life suffering on one hand or physician-assisted death on the other. We offer another option, one that is readily available in Massachusetts, that is hospice and palliative care. Through physical, psychosocial, emotional, and spiritual care for the patient and for the family, hospice provides comfort and dignity at the end of life. The patient and his or her healthcare proxy controls the decisions, physical pain is relieved, emotional and spiritual issues are addressed, the family is supported by compassionate experts, and the burden of the financial cost of care disappears with the comprehensive coverage provided under the hospice benefit. Directed by the legislature when the Health Care Access Law passed, in 2009, Governor Deval Patrick convened an expert panel on end-of-life care to examine care for the dying in Massachusetts. In their 2011 report, Patient-Centered Care and Human Mortality, the urgency of health system reforms to ensure respect for patients' wishes and accountability for excellence in care, the panel outlined knowledge gaps throughout the healthcare system about hospice and palliative care and described the lack of informed discussions about preferences for care at the end of life. The panel made several recommendations to transform end-of-life care and stated that to ensure that Massachusetts residents understand the full range of choices that are available to them and to ensure that healthcare decisions in the face of serious illness are anchored in each individual patient's goals and values, 3 concepts are essential: advanced care planning, palliative care, and hospice. Those who work in hospice know that the end of life can be comfortable, dignified, and meaningful. Last year, our hospice members cared for 40% of all those who died in the Commonwealth. Of those, though, 38% had hospice care for a week or less, and many more never had the care at all and who could have benefited from it. It is long overdue to address the unmet needs of the dying in all settings, hospitals, nursing facilities, as well as at home, and to assure that the education and advanced care planning recommended by the expert panel are widespread. Until that happens, it is not the time for public policy to condone physician-assisted dying as a solution. Let us not make the dying patient pay the price for the inadequacies of the healthcare system. As Dr. Kathleen Foley of New York Sloan Kettering Cancer Center said, it would be like treating the suffering by eliminating the sufferer. We believe the question should not be whether the state has an interest in allowing a person to ask a doctor to assist with their dying, but rather the state has an interest in shaping public policy that allows citizens a chance to live out their final days with comfort and with dignity. Consequently, we ask you not to report this bill out favorably. Instead, we would encourage you to reestablish and fund again the very successful Commission on End-of-Life Care that was formed by this very committee when bills like this were first introduced. Thank you very much for the opportunity to testify.
Thank you.
Thank you for the opportunity to testify before you today to state my opposition to an act relative to death with dignity. Both as a longtime hospice nurse and a person diagnosed with ALS, which is a terminal illness caused by complete paralysis, I believe that physician-assisted suicide is not a death penalty. I've been a registered nurse for 28 years and spent most of my career in hospice, both as a clinician and an administrator. During the last 5 years, I had a thriving national hospice consulting firm and worked part-time as a hospice surveyor for the Community Health Accreditation Program. It was in early 2009 when I noticed that my left foot flopped as I walked through very long airport terminals while traveling for work. Over the next 9 months, I felt my athletic body progressively disintegrating from muscle weakness, causing falls and my inability to climb stairs. On December 23, 2009, 8 days after my 25th wedding anniversary, and 2 days before Christmas, I was diagnosed with ALS, also known as Lou Gehrig's disease. As a hospice nurse, I had suspected that I had ALS well before my diagnosis. I knew that this cruel disease, what it was, terminal with no treatment to stop complete paralysis. My inability to speak and swallow. I most likely will die from respiratory failure within the next 2 years. As you can see, I'm no longer able to walk and am confined to a power wheelchair. This disease has the potential of robbing me of every shred of dignity. I am not afraid of dying, nor am I afraid of what the future holds, because I know that all of my needs will be taken care of by hospice professionals who devote their life to easing physical, emotional, and the spiritual pain of time. ALS is an unrelenting disease of daily losses. Loss of motor control, loss of independence, loss of the ability to communicate, can cause depression, isolation, physical pain, anxiety, difficulty breathing, feelings of helplessness, and hopelessness. Patients typically are concerned about being a financial and caregiving burden on the family. But I believe that physician-assisted suicide is not the answer when we have access in the Commonwealth to quality hospice care. Research has shown that hospice's multidisciplinary team approach provides a supportive environment for both patients and families to effectively manage symptoms of dying and improve the quality of life as death approaches naturally. Additionally, family and caregivers are provided bereavement support for up to 1 year after death. Physician-assisted suicide would not do this. As my end of life approaches, experience as a hospice professional assures me that I will remain in control, living my life to the fullest and free from the burden of pain. I know that my family will be supported through the caregiving and grieving process by a team of caring professionals who have helped so many terminally ill in the Commonwealth to achieve death with dignity. I ask that the committee does not report this bill out favorably. Thank you.
Thank you. Are there any questions for the lady? Any member of the committee or the witnesses? Seeing none, we thank you for testifying this afternoon. Thank you.